Well, good morning. Thank you again, Ms. Stagg, for joining me today. With me today is Helen Stagg, CEO of Change Happens, a community organization here in Houston. But I'll turn it over to Ms. Stagg now. Ms. Stagg, if you could tell us a little bit about, you're a graduate of the Graduate College of Social Work. If you could tell us a little bit about when you graduated and what Change Happens does for people who aren't familiar, because you provide a lot of services. So what kind of services does Change Happens provide?
Well, great. First of all, I'd like to thank you for inviting me to participate, and greetings to all of the students. Change Happens, a community-based organization. We have over 30 years working in the community. We are headquartered in the Third Ward community right near University of Houston. We have a holistic approach to providing services. So we have a wide variety of programs. The organization started 30 years ago. It was a substance use misuse treatment program. But from that, we learned that there are other needs that perhaps get a person to that using substances, issues of housing and access to health insurance and medical and treatment. And so we began to expand our programs based on the community needs that we saw. As a result of that, we have programs, we have a youth department that works with programs of working with incarcerated parents and males and fathers to provide transitioning and case management and support services, including employment and workforce training, mentors. We have a program working with teen pregnancy prevention. In fact, one of the professors at the Graduate College of Social Work is an external evaluator working on that project with us. We have programs that work with prevention services. We go into schools and community sites for prevention services of substance use, alcohol, tobacco. We are one of the 10 navigator programs for the Affordable Care Program in the United States. And we all know what's happened to reduce that Affordable Care Act, known as Obamacare, to this point, and what kind of impact it's having on this epidemic, this pandemic right now. We provide mentoring programs to children of prisoners and to young men of color attending Yates High School. We're a self-sufficiency program where we pay tuition for young people who are TANF eligible in terms of income to go to school to get a credential certification in areas of welding, logistics, forklift driving, and some of those other kind of high demand, higher wage paying jobs. We have HIV programs where we're trying to stop the spread of HIV, which includes testing, counseling, linkages to care, case management for pregnant women and children with special health needs, housing programs for permanent and supportive housing. And we lead a collection of organizations in the Third Ward area in terms of working on issues of affordable housing, education, increasing those opportunities, increasing services for families, children, and seniors, and also community engagement. So a wide range of programs.
Yeah.
And I finished through the Graduate College of Social Work in 2002. So I'm an alumni, and I'm also serving as an adjunct professor now.
Oh, that's awesome. Yeah. So that's a lot of really needed and important services that your agency is providing. What's happening now? What's been the impact of the pandemic on the ability to provide all of those services?
Yeah, because as a lot of the things that we do, we go to where the community is. So if we're working on HIV issues, we're working to people who may not know what their HIV status is. So a lot of the things that you see with this pandemic in trying to identify who is positive and how to mitigate that, that's what we do in the HIV program. So we go to where populations that the surveillance data or some indications that there may be clusters of HIV, the spread of HIV. And so when you can't get to those communities or those populations, it certainly changes. A lot of the work we do is with schools, and we know that all of the schools are closed. So our populations that we work with, we can't get to them. So we've had to make adjustments. Now, while we had a disaster plan in place that tracked us to inform us of how we're going to respond to a disaster, we did not have a plan in place for infectious diseases that would last the length of time with this amount of uncertainty, and that would really shut everything down. So we had to really get into a rapid mode of making adjustments to that.
Mhm.
And what we've done as a result, our offices are closed, so we're working remotely. We have 61 staff, and everybody's working remotely. And so what we're doing is working with our partnerships, like working with our schools to try and engage and be involved in some of the virtual activities that they're doing. So partnering with them to bring our same program activities, but bring it into a virtual classroom that they're having. We're trying to do that with all of our programs. Like with our substance use programs, we contract with providers who provide substance use treatment. So they're offering more telehealth medicine and counseling via virtual counseling sessions. So we're converting a lot of the activities that we do in our one-to-one, face-to-face to those kinds of activities. We're using social media a lot as well. So we're using all those various platforms to try and stay engaged with the partners. We're doing some kinds of things that like having virtual parties with program participants. So we have a group of school children who are in a program. We may have set up a virtual party where we have packets of arts and crafts delivered to them, and then go through some of the lessons where we are all working on that particular project. So we've had to change those things, and not just for the clients that we serve, but also for our staff. So it's an opportunity for more kinds of trainings and webinars, and we're using more virtual technology to communicate with all of our funders. We have a number of federal, state funders, so we're using those opportunities to talk with them, to get additional training and insights. So it's been that kind of adjustments.
Great. That's great. It sounds like you've had to be really innovative and creative really fast. But as you were talking, it just strikes me that even though you've done a lot to try to adapt and respond, there are going to be people that fall through the cracks or aren't getting the services that they would have had before. And you're dealing with a population or with populations that are vulnerable in many ways and at risk of negative things occurring. What do you think's what's the impact of this going to be on the inequities that we already see in society? What's the impact this pandemic's going to have?
Yeah, I think one of the things that we see in all of this is that all of those issues were there before the pandemic strike, but what it does, it really does magnify these kind of cracks in our social safety net and how we respond to people. So for instance, if we're talking about homeless populations, there's not a way that you can readily access them without going to where they are in encampments. So they don't have access to the internet or a computer or means to do that. They may have phones, but they're limited in how they can use those phones. So that's one of the ways that we can't have the one-to-one contact, and yet we know that there are services that they need. So one of the things that we've done, for instance, with that is look at ways that we can raise funds and money to expand our supplies to them. How can they keep safe during this? So preparing hygiene supplies and hygiene packets and information that we can get directly to them that doesn't require necessarily a face-to-face, but it would require us to go and keep the social and physical distancing and observe those rules, but yet still be able to get the supplies that might help them stay safe. Those are some of the things that we've had to look at, because the other thing is like the youth that we're working with. You know, we see that children who are out of school, particularly in the third ward, a number of them don't have access to computers, or they don't have access to internet or Wi-Fi. So if the school is closing and they're using that kind of technology to teach lessons, then they're going to fall further behind. And so that we tried to respond to by also raising funds to be able to help Blackshear Elementary students and Yates High School, both right there in the third ward, to help purchase and buy laptop computers and also support access to the internet and Wi-Fi. So we're trying to look at what's going on within the communities that we serve, and then find ways to help support in those areas so that people don't fall further into the cracks and suffer more negative consequences.
Right, right, right. I just keep thinking, your agency Change Happens works with such a vulnerable population. And if you talk about people who are incarcerated, the homeless population, people that don't have access to the internet, access to technology, I keep trying to think of what we can do differently as a society so that the next time we experience something like this, those really vulnerable populations aren't the ones that are so severely impacted. If we could think about like expanding our moral imagination, what
Mm-hmm.
what are things that you'd like to see us doing differently in society so that the challenges we face, like homelessness, mass incarceration, substance use, all of those things are there ways we can respond to those differently so we don't see these really harmful impacts when we go through a crisis like this?
Yeah, I think so. And like I was saying before, I think all of those we all of those things existed before this, and now we see that how it's impacting this disease as well. So when we look across the country and see the people who are disproportionately affected by it, no matter if you're in New York or Michigan or Louisiana, even here in Houston, where 52% of the people who are most affected and die from it are African Americans. So we have those kind of questions that you might ask in every situation, a crisis. Why is it that the poorest people are the people who surface the have the worst consequences or the worst outcomes? So I think that's a basic question that we could begin to look at as a community to figure out then why is it that the poverty and the poorest people suffer more disproportionately than anyone else. And then that helps to drive us on activities and implement interventions and things that we can work together on. We hear it said a lot that we're all in this together. So I think not just are we all in the uncertainty of the moment that we're in, but we're all in it together in terms of how we're going to proceed as we come out of it. And so I think working together is going to be one of those things, working on that basic issue about why it is that the poorest of us suffer the worst consequences. And that's all of us. One of the things that Change Happens is going to be using our imagination and ideas is to try to look at that basic question and then pull the pieces together to work on issues of advocacy and implementation and interventions that can help in areas so that people don't suffer disproportionately as we see now.
Yeah, I really think it's going to take all of us working together, like you said, and particularly on the advocacy piece, because it keeps coming down to the fact that we as a society seems like we've just gotten complacent with having so many people live in really dire poverty. And we just have to do more to address that. So how could we help? If you're speaking to the broader social work community, what can we do to help change happens in the people that you're serving?
Well, right now we're raising funds in 3 areas, and we're going to need some volunteers as soon as we begin to do some of that. One of the areas is trying to provide additional food for young people who are out of school. We're working with Blackshear Elementary. You know, almost 95% of the population at Blackshear is on free or reduced lunch. they were already had such a need for food. They had already implemented a buddies kind of program so that they could send kids home over the weekend with food uh, until they returned to school because they depended so much on getting food. So we're working with them to help families get additional access to food during the school closures because they're missing breakfast and lunch through schools. We're also working to provide food to seniors in the area, people over 65 who are disabled and who are seniors. We're working on getting computers for 150 students at Blacksher and at Yates High School, and the internet access as well, and then the hygiene supplies. So when and we've just began those efforts in the last 3 weeks. So as we raise funds for that, we'll be putting opportunities in place for volunteers to assist with the distribution, the packaging, things that we might need to do, all practice safely, but people might be able to help. We have appeal letters and opportunities for donations. We also post volunteer activities on our website because we try to coordinate with other organizations all over. So when they have things that are going on and that they need volunteers, we post that as well on all, not just Change Happens volunteer opportunities, but other community-based organizations. So by checking our website, changehappens.tx.org, there are ways to find out about all of the volunteer activities.
Wonderful. So if people are able and want to help, it's changehappenstx.org.
That's right.
Okay. Well, thank you very much, Ms. Stagg. I really appreciate you taking the time to chat with me today. I know that as CEO of such a large organization, you're incredibly busy, but I really appreciate this.
Well, thank you very much. I enjoyed the conversation.
Thank you.
Okay.